All right. So, welcome to this month's TSAC meeting. I am Chanel P, the InReach unit supervisor, and then we are recording the meeting. As you can see, if you have any questions or anything, please put them in the chat. And there are some other HICPUF team members who can possibly answer those for you. And then we'll circle back around. If you are listening by the phone, press 9* to mute your line or *9 to raise your hand. And then if you need to use closed captioning, that is located at the bottom of the task list on Zoom. And then if you are requiring any accommodations, please reach out to John Barry and he will be able to help facilitate those for you. Okay, so this is our agenda for today. It probably is going to be pretty quick. I don't foresee us taking up the entire time unless at the end there are some things that we need to discuss or there's additional questions. So for the agenda today, we're going to have a sheet update from Melissa, who is on the call. And then we're going to have an update on presumptive eligibility from Amy Dearmore. And then for the options counseling agencies, we'll talk about Group InReach and that contract, just some updates there, as well as discuss the transition escalation email and a document that the InReach team created to support nursing facility social service directors or anyone in the nursing facility who's helping with transitions. And then we'll have time for the open forum after that. Okay. So at this time, I am going to hand it over to Melissa, and she'll pull up some slides for her to present.
Awesome. Thank you, Chanel. Let me just share my screen, make sure that all works. All right. So hopefully you should all be seeing a PowerPoint. It says the Colorado Social Health Information Exchange. Everyone seeing that? Seeing some head nods. Awesome, thank you. All right, so as Chanel said, my name is Melissa Gillespie, and I am the Social Determinants of Health Business Analyst from Healthcare Policy and Financing, and I am mostly working on the Colorado Social Health Information Exchange, or COSHI project. This project is being led by the Office of eHealth Innovation in partnership with HICPUF. So basically, what is the problem that COSHI is trying to solve? Like with many projects, usually we start off with trying to solve some things that are going on in the landscape. So to start off with, social determinants of health like affordable housing and accessing food and safe transportation have significant impacts on a person's health outcomes. Colorado's social care ecosystem is fragmented and siloed. As I'm sure many of you experience, providers rarely have the information they need in one system to make informed decisions around supporting individuals in accessing holistic care. Additionally, the burden of social care falls primarily on the person, which means that they have to repeatedly tell their story to multiple providers, which may be traumatic. And they have to spend a significant amount of time and energy trying to access services that they need. So to address these problems, we are taking a two-pronged approach. The first prong funds building a network that focuses on interoperability, flexibility, and data governance. We refer to this prong as the state unifying architecture. Basically, the unifying architecture is not meant to be one platform to rule them all. We really are trying to take not take a one-size-fits-all approach and focusing on flexibility. The second prong, it funds regional infrastructure and partnership building for priority use cases. This prong will be funded through a competitive request for applications or RFA, which will be launching this fall 2024. So the overall goal of this project really is to increase interoperability and data sharing without forcing significant changes to providers, which basically means that we want providers to stay within the systems that they prefer to use, instead of making them move into a single system where all the information will be housed. We want people to stay where they're already working and what's working well for them. Another goal is to reduce administrative burden on providers as well as patients. And generally, we want to make it easier to deliver and access social care. With new systems and tools, it can be helpful to define what the tool is not. So Koshi is not a closed loop referral platform. It is also not a surveillance tool or research tool, or a replacement or competitor to other health IT solutions. It is a complementary architecture. So to highlight some other things that the Koshi is, it is a tool and system that is customizable and flexible. We have a 10-year development plan. The system will be deployed very soon here. Our first wave is this month, at the end of the month, September 30th, through June 30th, 2020. Oh, I said 2024 in my notes, but 2034. So it's a long project. We want that kind of long runway so that we can take a really flexible approach for each of the use cases and each of the situations that we will be tackling and trying to address with Koshi. And lastly, it is a vendor agnostic, modular, and modern system where we want to build something that can grow and change along with Colorado and the tech landscape. And then here, I wanted to give you a slide to kind of highlight some of the waves. Like I mentioned, we basically will be deploying the tool in a series of waves. Right now, we have mostly highlighted waves 1 through 4, but there will be really a succession of waves throughout the entire project timeline. So to start off with, this fall, we will be deploying a release that is focused on the core architecture, as well as accelerating home and community-based transitions referrals, specifically referrals that are going to options counseling agencies. That's where we started with the process and really focusing on improving that referral workflow. And then, as you can see, the wave 2 will be released in spring 2025. And then we'll have another wave in the summer of 2025, and then again in the fall of 2025. So we're focused on kind of having, yeah, like I said, a succession of waves, deploying specific use cases and opportunities with each of those waves over time. So yeah, that's a little bit of what we're working on with the Koshi project. I wanted to give opportunity for any questions. And then I also have some resources and contact information that I can share. But yeah, I can give space for any questions. All right.
Thank you, Melissa. And as she said, we are kind of using this process right now for a referral source for options counseling agencies or a referral system. So there is more to come on that. And I know a lot of the options counseling agencies are working directly with Melissa and her team to make sure we're getting this right. So thank you. All right. So next we are going to have Amy Dearmore come and give us an update on presumptive eligibility.
Oh, can you hear me? It looks like my screen froze, and I'm so sorry if that happens periodically. Of course, it happens right now. Anyway, yeah. Hi, everyone. If I haven't met you yet, my name is Amy Dearmore, and I work as a policy advisor here in the Office of Community Living at the Department of Healthcare Policy and Financing. And I wanted to provide some program updates regarding this new upcoming program, which is presumptive eligibility for long-term services and supports. However, being mindful that possibly this may be new information for some people in this meeting, I wanted to maybe start with just a little overview. So, Chanel, do you mind going to the next slide for a second, and then we'll come back to this one? Thank you. Um, so if this may be a refresher or it may be new information, if it is new information for you, please feel free to raise your hand, come off mute to ask any questions that you need for some clarification. But just to provide an overview, presumptive eligibility for the long-term services and supports population is looking at a targeted implementation date of January 1st of 2026. Through this program, a defined package of LTSS services will be available to individuals experiencing a defined crisis situation that puts them at risk of nursing facility admission. You can see here those kind of sub-bullet points include some of the crisis criteria that we are currently considering. And this is also a piece that we're looking for stakeholder feedback on specifically. You can see that we're currently considering a loss or incapacitation of caregiver, having experienced a recent episode, and or being a danger to oneself or others. Oh, sorry. Is my screen being weird or my connection? Okay. For this program, applicants will be able to self-attest to meeting financial eligibility for long-term care Medicaid, functional or level of care eligibility for HCBS, as well as self-attest to meeting these defined crisis criteria. And then you can see the goal is to connect the individual with services as quickly as possible while they go through the regular eligibility process with the counties. And then this bottom bullet point, we're estimating roughly 100 to 200 individuals annually that we're able to serve with this program through the funding from the 1115 demonstration waiver. This is a rough estimate. It's nothing set in stone, but just important, I think, to broadcast that we're not expecting like an unending source of members coming through who are eligible for this LTSS program. And so that's a really, really extremely high level and brief overview. And if anyone has questions about some additional program details regarding this slide specifically, I would be happy to answer. Go ahead, Kristen.
I just had a question. Do you guys have a time frame in regards to this presumptive eligibility? How long it's active for?
Yeah, so that's a good question. So as we are looking to implement this through our 1115 demonstration waiver, that does kind of define that for us as far as some structure. Typically, 1115 demonstration waivers are approved for 5 years initially. And then at that time, states typically send another application again for another 5 years. And then at that point, sometimes the Centers for Medicare and Medicaid Services will kind of expand that 1115 approval period. But typically it's every 5 years or so. That being said, we are not looking to kind of cut this program off after 5 years. The idea is that it would be a really successful and positive program that we hope to continue past the 5-year mark. Is your hand raised again, Kristen?
Yeah, I misspoke. I meant for the population you're looking to serve. Just because eligibility seems to be a moving target, it does not occur quickly at this time. Therefore,
Thank you.
I'm curious if there is a time frame in regards to how long the eligibility will be active for self-attested financial and functional eligibility.
Thanks so much. So you just got a free lesson in 1115s from that. And so, yeah, so we're looking at offering this for a period of up to 90 days or until long-term care Medicaid eligibility is determined. And that 90 days does follow federal guidelines regarding financial eligibility processing. Go ahead, Heather.
What if after they've determined eligibility that the person isn't eligible, do they have to pay back the funds or is there just already funding put in place for them to, not have to worry about that?
Great question. And it comes up a lot. So I'm really happy you asked it here because I'm sure other people were also wondering. So as part of our 1115 application, we are able to request a budget to cover the services and other operations needed for this program. And within that budget request, we are requesting budget for that contingency in the case that someone is not found eligible for long-term care Medicaid or HCBS, that the services provided will be paid for through that funding. And so no one will be held responsible for services rendered during presumptive eligibility if someone is ultimately found ineligible for long-term care Medicaid. Service providers will will be paid regardless of someone's eligibility determination. Questions? All right, if there's nothing else regarding this slide, Chanel, do you mind going back one, please? Thanks. So I just wanted to provide some updates. So we have been doing a ton of stakeholder engagement and getting really great feedback. The stakeholder engagement that we've been conducting includes with groups such as many county groups across the state, case management agencies, adult protective services, and also transition coordination agency leadership, and also other kind of key groups around the state. Again, receiving a lot of great feedback and hope to continue to do so. The questions that we have been getting, or I guess the feedback that we've been getting, a lot of excitement about this new program and kind of what it will mean for our Health First Colorado members. Also some concerns, including kind of what you would imagine, including provider capacity, the impact to various agencies, and also concerns surrounding long-term care Medicaid eligibility timelines. We've also been receiving a lot of requests for stakeholders to be able to see a process flow as far as what are the nuts and bolts for what this program will actually look like. And so I will be sharing that in a slide here in a second. Another update is that we are about to enter the public review and public comment period as necessitated by our 1115 application. And so what that looks like is from September 10th through October 10th of this year, the public will have the opportunity to review and comment on our 1115 application components. And just as a note, while the public comment period ends on October 10th, the tribal consult period will extend through November 9th. And I just want to make sure that this group knows that even though we're kind of in this phase of requesting feedback now, there are many components to this program that we'll be able to continue to discuss and get feedback on and work through much past the public comment period ending. And so what is needed for the public comment period, as well as the application submission for the 1115, are really kind of the high level skeleton, I guess, if you will, as far as what the main structure of the program will be. And like I said, a lot of these process details and program details will be able to be discussed past that point. I think that is it for this slide. Any questions on this slide in particular? Okay. So the long-awaited process flow. And so what you can see here is a really high-level draft of a process flow that we're currently working through. Nothing is set in stone. We're still very much working through and discussing different aspects of this process flow, but we think it's important to have some transparency with our stakeholders to see kind of what we're thinking about as far as what this program will look like. And so what you see here is some different colors and boxes. The different colors differentiate the different individuals or entities who are looking at being responsible for the different steps of this LTSS-PE program. And so the pink entity, which is kind of the third row down, pink or mauve entity, What we're thinking about that role is because of the level and quality of member care required by this LTSSPE facilitator, we've been discussing the opportunity for organizations such as transition coordination agencies to fill this role or function for LTSSPE. As far as the other boxes here, the green, the second one down, kind of demonstrates the county's role. The county role as far as long-term care Medicaid financial eligibility processing will remain in place as far as they'll receive the referral for long-term care Medicaid eligibility processing and continue that through the current processes and timelines that currently operate. Same goes for the very bottom line of boxes, which is the light blue, that represents case management agencies who will also continue to process the HCBS eligibility steps for LTSS-PE members during the presumptive eligibility period. So they'll receive the referral and then complete their level of care assessment and other intake steps. And then following their current timelines, then be able to enroll someone onto HCBS. And then lastly, you can see kind of the gray clouds on there represent some thought bubbles, I guess, as far as just a small sampling of the areas that we want to continue to hear from stakeholders on as far as their considerations for these items. Of course, this isn't every aspect that we want to discuss and try to continue to work through, but it's kind of a small sampling. Any feedback, questions, comments on this slide? My screen froze at all during this. I'm having kind of yucky internet connection. Don't be shy about saying, hey, I missed what you were saying. Can you go back? And so, as always, an important part of the development of this program, like I said, is stakeholder feedback. And so what we'd like to hear about is what do we need to consider when continuing to develop this process flow? Also, what do we need to consider when continuing to develop other program aspects? And lastly, what level of engagement about this new program would be helpful moving forward? Any thoughts on those questions? Give you just a couple seconds to process maybe. Yeah, go ahead, Kristen.
I don't think 90 days is sufficient in regards to gaining eligibility through Medicaid. I believe it's closer to a year at this time. Therefore, I'm concerned that you guys might not have the correct, funding in place if you only have budgeted for 90 days versus longer than that for presumptive eligibility to be maintained.
Yeah, thanks for that, Kristen. I just want to offer that kind of why we landed on 90 days is that does support federal regulations concerning long-term care Medicaid financial eligibility. And that being said, process flow slide.
I'm sorry, you cut out. I couldn't hear
There we
you.
go. Sorry about that. I don't know if you heard me or not on this. So the 90-day, where we landed on 90 days does support the federal regulations surrounding long-term care financial eligibility processing. So that's kind of where we landed there. That being said, I want to kind of go back to the slide and highlight that we want to have some conversation around whether there is something that the orange at the top that person or entity could do kind of on the front end to help streamline or not expedite, but streamline, I guess is the right word, or simplify or ease the county workload when processing these long-term care Medicaid eligibility cases. We're not asking the counties to expedite, but rather like, oh, is there something that this entity or person can do on the front end to help, allow this to go through in the currently established timeline? Go ahead, Robin.
Hi, I'm on a playground picking up kids, so it's going to be noisy. Can you hear me okay?
Yeah, thanks.
Okay. Yeah, will folks have access to the full array of like waiver benefits? That's a concern. What we see are folks, well, especially folks leaving nursing homes, there's no bridge or very little as far as a bridge from facility care to community-based long-term care. So folks don't have the wheelchairs they need to live in the community. They may not have ramps and bathrooms in an efficient manner, you know, like when they're leaving rather than 6 months to a year from when they start the process. So I guess I'm trying to figure out how this makes it more efficient for folks to leave nursing homes. And there wasn't in your population, folks leaving nursing homes was not identified as a population. So I'm a little confused by that.
Thanks. So thanks for that feedback. And so yeah, we're not kind of centering our focus on folks leaving nursing facilities, but rather experiencing one of the defined crisis situations. If you remember from a previous slide, the pool that we're able to serve through funding from the 1115 specifically is relatively small, and so we're trying to be really careful about how to develop our eligibility criteria so that it really is impactful for members in a crisis situation, but isn't just kind of another doorway to enroll onto LTSS services. So and I know you had another question that I wanted to, or another aspect to your question that I wanted to get to. Robin, do you mind? Was there something something else that you said?
Yeah, well, I guess I had another question. So mostly what I've done with Colorado Cross Disability Coalition is divert people from nursing homes. A lot of them are leaving rehab facilities. So are they going to fall? So are my folks leaving like Craig Hospital? Would they fall under this program? Because this has been an issue for folks in rehab. They've been discharged to nothingness.
Yeah, that's a great point. I really appreciate that feedback. It sounds like you have some unique perspective to share on that. So I appreciate you sharing that. And what I was hearing from another part of your question is kind of, and forgive me if I misinterpreted, but kind of like what are the services that we're looking at to offer? So with this program, we're looking to offer just a small handful of defined LTSS services with the idea that they would really address someone during and throughout a crisis situation. So what we're looking at currently include things like personal care, homemaker, respite, long-term home health, home delivered meals, a personal emergency response system, and transition coordination. So, that's a small handful we're currently considering. And so, anyway, so happy to hear some additional feedback on that part if this group has it. Anything else on the process flow slide?
Can I just get this is LaShawn, can I just get a correction? Is life skills training a part of those services?
Yep. And so, and this group may be able to kind of correct me on this. So as we are currently considering transition coordination as one of the services included with LTSS-PE, I believe that it would include the breadth of transition coordination supports currently offered. And so I don't know if that answers your question well enough or not.
Well, life skills services is a HCBS service, not a transition service.
Thank you. Thanks for that question. Let me kind of take that back and we'll kind of discuss that part, LaShawn. Thanks.
Thank you.
And did you have another question? Maybe not. I know that she said she was kind of in a place that was difficult to hear maybe. So, thank you. Thanks for this discussion surrounding this process flow. And so again, back to these questions here. If there is housing modification, Robin is commenting Yeah, housing modification as a service. Thanks for that feedback. Um, and so it looks like we kind of already discussed some of these questions on this slide. And if someone would like to reach out as far as discussion about what level of engagement about this new program would be helpful moving forward, I would be happy to talk about that. And is there another
Yeah, there was one more
slide?
in the chat. Shannon asks who would be putting in the PAR for the immediate services.
Yeah, thanks for that. So, as if we are still talking about the different roles that the different people or entities would play, that is a piece that we're still kind of, looking at. But the facilitator, this LTSSPE facilitator, which was that pink row, would be the one to authorize and initiate these LTSSPE services. We're not sure whether it would be an actual PAR, but rather maybe kind of an authorization in a different way for this package of services. So more to kind of talk through regarding that piece. Thank you, everyone. Thanks for the great discussion. And I'm going to put in the chat the link to the LTSSPE website. And on that are some different ways to provide feedback. And so that includes an email address. And so if you have any thoughts you'd like to email directly, then you're welcome to do so. Thank you.
Thanks, Amy. All right, so the next portion, I really wanted to talk about the group inReach contract and kind of give an update on that. So our hopes were that group inReach could have started in July, and the contract has been in clearance. The ongoing conversations that I've been having are that due to the increase in contract amount as well as the new statement of work, it's just taking everyone a little bit longer to review that. And so one of the things that as a team we're going to try and do is be more mindful of that in the future and ensure that we try and get those contracts in a lot earlier, so we don't have this issue. One of the things that has come up is that in the group inReach contract, there are some deliverables that are going to be due or that were supposed to be due on September 15th. And so I'm in conversations with procurement about if we need to change that language in the contract to put in new dates, or can we just send out information to all of you to inform you that that is not going to be due for you on the 15th, obviously, because you have not been able to sign the contracts. So I just wanted to flag that for everyone, that even though you've seen the contract, the expectation is not that you're doing this work until the amendment is completed and signed by all the parties. And so the deliverables that were coming up were the regional resource document, the group inReach plan, and the group inReach presentation. And my plan is to send out an updated due date for those deliverables, myself or Susie, depending on who is available. Once we know when that contract is going to come out of clearance. I didn't want to try and put something in right now and then we come to that date and it's not out of clearance. So that's kind of the update for that. So I just wanted to check and see if there were any other comments, or concerns around the group inReach contract. Okay. I am not seeing any, so I'm going to move forward. And then one other thing that I wanted to flag for you all is that for any of the transition escalations, we do have a new process. I know previously a lot of those things were going directly to Nora Bray, but we're trying to build in Salesforce and kind of have more of a system for that so that there's more tracking and more support for that process. And so we're asking that any escalations that come up for transition services or transitions in general, that you email it to this email, HCPF underscore TCM underscore TC underscore escalations at state.co.us. And like I said, it's really going to help us streamline those escalations and try and get them to exactly who they need to go to. I believe if you email the old email, it is going to send you an automatic reply and ask you to email this email. And we also put this information in the department's communication, so it should be there as well. Okay. And then one other thing we wanted to flag for you all is the InReach team. We're working on some quick references for the social service directors or nursing facility support. And so that document is out of clearance and it is available for your use. Victoria just threw it into the chat, but it essentially has information about PASSAR, MDS, where they can get training from for those things, whether it's through CPHE or HICPUF themselves. It also gives some information and resources about funding outside of Medicaid if someone does not outside of Medicaid, I'm sorry, out of long-term care Medicaid, if someone doesn't qualify for long-term care Medicaid for some reason. And then also points them to the agencies and community supports that you all provide. So just wanted to put that out there. It's probably a resource that you could be giving to nursing facility staff and directors when you're having conversations with them, or if they're continuously tool. Okay. And then we're kind of at our open forum. So we kind of want to hear from you and see if there's anything that we need to be working on or that we've overlooked that you guys would like for us to kind of work through, or have conversations among yourselves, or ask questions about stuff that's happening in your region, and kind of get that support there. So I will open the floor to anyone who may have something. And Robin, I see your chat. Was that a request for the department or a request for options counseling agencies or transition coordination agencies?
I would assume that all lies within the department, that it's some sort of standard information that each agency would be using the same assessment. If I'm wrong, this is a little bit new to me. CCDC has worked really hard to develop a really good community service system.
Yeah.
And I think we're one of the best in the nation. But what we recently discovered is some of our folks are being deemed not feasible to live in the community. And that's incredibly concerning. So we're trying to get a handle on why this isn't. We're not being antagonistic. We want to know why so we can help change that trend.
And so for individuals moving or transitioning from a nursing facility into the community, that conversation really happens with the transition coordination agencies and the members' transition team. And I know that the transition coordination agencies have their risk mitigation assessment that they use to work with individuals. That actually lives with Nora Bray. And so if
Okay.
you want to give me your email or send an email directly to her, I'm sure she would be able to provide that for you.
Oh, great. That would be great. So it is a standard, I'm using the wrong terminology, obviously. So it is a standard form that they all use.
Um,
And
Yeah, and
or,
anybody on the transition coordination side, you can, and if I'm incorrect, but I believe all of that is now in the CCM system, and that is what they use when talking to the member about what their risk may be when transitioning into the community, and then discussing what services and supports are available to mitigate those risks.
Hi, Chanel. This is LaShawn with the Love Foundation 303. And I just want to make sure I understood the question. I believe her question was more related to the CMS agencies using the tool for the 100.2, but I could be wrong. Can you correct me?
no, that would be LTC 100.2. So no, it seemed to be of the folks that I talked to that are in nursing homes or we're helping to get out by providing extra support to the transition counselors, is that a transition counselor talked to them, and I basically said they weren't feasible for leaving because there wasn't the level of services available in the community for them.
So
That's
what a case manager does at our CMS agencies.
no, this is before. They're not even being referred to the CMS, to the case manager. They're not even going there.
Can I help,
And
Robin? This is
okay, Monique. Hi. Yeah, you understand what I'm asking.
Yes. What she's, to clarify, LaShawn, her question is how is the transition coordinator making that determination and between the risk mitigation assessment and the transition recommendation form, where we say we recommend it or we don't recommend it based on services and supports being available in the community based on the members' needs. That's what Robin.
James Funny, exactly. That's exactly what I'm asking for. So it doesn't get to the case manager yet. Somewhere along the line, and again, this is new, definitely to me as an advocate, this process. So I'm just trying to get information to see where kind of the system feels like it's falling down for those of us in the disability rights community, and understand that some of the folks we're talking to, their level of disability is less than our members who have always lived in the community. So it's incredibly concerning. Our suspicion is that some of the agencies, that counseling agencies, don't have access to the information they need to make a recommendation.
Awesome. Thank you for that, Robin. And yeah, we can definitely take that offline, and we can connect with Nora, who does the oversight for transition coordination. So she can kind of give you that plan and kind of the set expectations for those agencies. So
Perfect. Thank you.
thank you. And then I think Jennifer Reeves asks, does HICPUF have a plan to update transition coordination agency provider list for the state? There have been some changes to TCAs in the Denver region over the past few years, and the current list hasn't been updated since January of 2022. And so I know that my team has been looking at that list. I think another thing that came up was that it was very hard to read and look at online. And so we've been working with Nora to try and get that list updated, as well as get a new list online. So that has been brought to our attention, and there is a plan to get it taken care of. I can definitely follow up and see where we are with that. And while we're speaking on updating HICPUF state websites, I did follow up, and we are also in the process of updating the TSAC page on our website. I was checking it out today. It has the old Google link and some other things, but we can plan what needs to be done, but we have to work with somebody obviously outside of our team to get that updated. So that is also in the works. All right. Did that answer your question, Jen? Yeah.
Yes, that was what I was looking for. Thank you.
Awesome. Okay. All right. Anything else? Monique. I don't know if your hand is up new or from when you were speaking before.
I hadn't actually asked my question from before. And of course, now I've forgotten it. But I wanted
Uh-oh.
to say, I found the link for the forms for you for Robin, so you can check them for yourself. The transition forms.
Yes. Are they they're on the state website?
They're they're online.
Okay.
They're on the transition website.
Okay.
And I
Yeah.
just that
Thank you. So yeah, Robin, if you want to start there at the forms that we have online, and then I will still connect you with Nora, just so you can have some more direct conversations about kind of what the training is, what those expectations are. Um, and I'm sure we can get you all caught up and then also have conversations about things that you may find or that may come up while you're looking through that.
So the other question I did have, Chanel, was the group inReach contracts. I haven't actually been engaged in the conversation, but can you give me a tiny, summary?
Yeah. So Group InReach is going to be kind of an ongoing education program for individuals living in a skilled nursing facility. The options counseling agencies will go into those nursing facilities 2 times a year or every 6 months, and they will coordinate with the nursing facilities to invite members or residents of that nursing facility to basically hear a presentation about what community living options are available, really speak to um, transitioning into the community, kind of set those guidelines for what the transition timelines look like, and then answer any questions that individuals may have about transitioning from a nursing facility into a community setting. And so also from that meeting, the options counseling agents are going to be able to, are going to be able to do referrals directly to transition coordination from that meeting. And so we're really looking at trying to be proactive in educating members and not only waiting for those referrals to come through either like our Google form or through the MDS. We're really trying to get out there and talk to people and let them know what's available prior to them hearing about a referral.
Perfect. Thank you so much for
Of
clarifying.
course, of course. All right. Anyone else? And this doesn't have to be just stuff for HickPuff. It could be things that you all want to ask each other or about processes. So it's truly an open forum for you all to use. Okay. Well, Jennifer Lynn, I think you came off mute. Did you have something or? All right. Well, not hearing anything further. This is my and Matt Bohannon's information. And so if you need anything, you guys are all more than welcome to contact us directly. And I think that is the meeting for today. So I'll hang out just in case something else comes up, but you are more than welcome to take off. Thank you.
Thank you, Chanel.
Thanks, Chanel.